Vision is looking after your children this morning, especially as we approach Halloween.
Schools sending out an alert to families in the district.
First, it was razor blades and apples, then marijuana-infused gummies. But this year, parents' Halloween scare is Rainbow Fentanyl.
This is every parent's worst nightmare, especially in the month of October as Halloween fast approaches.
It's the newest concern, which is something called Rainbow Fentanyl.
Yes, this is the time of year kids are thinking about that candy they're going to collect on Halloween. The Drug Enforcement Agency, though, says parents should take that extra step this year to make sure that candy is safe.
On August 30th, 2022, the DEA issued a very alarming warning regarding brightly colored fentanyl used to target young Americans. Washington State, the Drug Enforcement Administration is advising the public of an alarming emerging trend of colorful fentanyl available across the United States. It may not be a secret that the opioid crisis is a public health emergency affecting communities all around the states, and it's even a concerning problem affecting many communities worldwide. One of the drugs you probably know as being involved in the crisis, especially in recent years, is fentanyl, and there are plenty of concerns regarding how these drugs in particular are affecting the younger demographic. But what if I told you that in 2022, there was a new concern that lurked around? A quote, highly addictive and potentially deadly fentanyl apparently made to look like candy to children and young people. Rainbow Fentanyl. For a while, whenever Halloween season would come around, many would live in fear with concerns of their children's Halloween candy potentially being tampered with. So it was no shock the concern many people had when they discovered busts that have happened where this new rainbow fentanyl had been found disguised in various candy packages across the states. News articles, media reports, schools, many sources were sending out warnings to parents and young people, cautioning them about this new, bright, very colorful, very dangerous drug. But the ultimate question this posed is, was the concern of potentially receiving colorful fentanyl in one's Halloween bag a true problem on the rise? Or was this fear hiding a much deeper secret of what was and is truly going on right now as we speak? Today we'll be discussing Halloween sadism and how the fears concerning tampered Halloween candy had possibly been masking an even scarier problem, one you might not have even realized was happening in your own community. But before we get into this case, just to introduce myself, my name is Petal Palmer, and on this channel I post anything medical, mysteries, and crime. If that is something that sounds interesting to you, please consider subscribing if you end up liking this video. But before we get into this case, I'd like to take a minute to thank the sponsor of today's video, Morgan & Morgan. Okay, so Morgan & Morgan is actually the largest injury law firm in America, and they work by making sure that if you're ever seriously hurt, that they fight to get you the claims you deserve. They have a promise of being for the people, and with this promise, they make sure to not settle for lowball offers. For example, in New York, they saw verdicts of $6.8 million, which is 25 times the highest insurance offer. And in Philadelphia, they saw verdicts of $26 million. 40 times the highest insurance offer. And what's very cool is that unless you win, the fee is actually free for you. If you're ever in an accident or if you're ever injured in any way, you should know how to protect your rights. And considering I cover a lot of medical malpractice cases and I'm also in the hospital quite often myself, I think it's important to check out a company like Morgan & Morgan because unfortunately you never know what might happen as a patient, and even not just as a patient, but as a person in general. You're able to start a claim with America's largest injury firm in just one click. It's very simple. All you have to do is head to www.forthepeople.com/petal or click the link in the description below to start a claim now with Morgan & Morgan. Thank you, Morgan & Morgan, for sponsoring this video. Now let's get into this case. On August 30th, 2022, the Drug Enforcement Administration, or DEA, issued a warning informing those in states about a new trend appearing to target young Americans. Quote, dubbed Rainbow Fentanyl in the media, this trend appears to be a new method used by drug cartels to sell highly addictive and potentially deadly fentanyl made to look like candy to children and young people. People were already concerned to see this warning issued right at the end of summer before, or for some, after the start of the school year. So it definitely didn't help when many would soon learn about major rainbow fentanyl busts that would happen right before the start of spooky season or Halloween that year. September 8th, 2022, in Wethersfield, Connecticut, 2 men were found with around 15,000 rainbow fentanyl pills packaged in Rainbow Nerds boxes and Skittles packets. In early October 2022, in New York City, a woman was caught smuggling more than 15,000 rainbow fentanyl tabs in a box of Legos. And on October 22nd, 2022, at the LAX airport, authorities seized about 12,000 rainbow fentanyl pills disguised in Sweet Tarts, Skittles, and Whoppers candy boxes. When news broke out about this, reports were being issued rapidly. Schools were sending out letters, parents were concerned, and with these major busts happening very shortly after the DEA released their warning, news articles and reporters were beginning to heavily cover this issue, warning people to stay cautious that Halloween season. There became a fear in many that this rainbow fentanyl would possibly be given in children's Halloween bags. And what's interesting is that this fear regarding Halloween candy being tampered with isn't something that just started in 2022 after this warning was issued. In fact, this has been a concern that's been going on for several decades. October 31st, 1959, Halloween Day in Fremont, California. Children of the Glenmore Gardens neighborhood all went out to enjoy the night of trick-or-treating, simply collecting candy from those in their residential area. This was a typical Halloween for most kids. They knocked on the neighbors' doors, asked trick-or-treat, and skipped off into the distance with their collected candy to do the same at the next home. Now, as the night summed up and the neighborhood children were on their way back home to sort through their precious finds, many parents began noticing something strange in their children's bags. As they looked through the candy their children collected, parents were noticing that there were these little heart-shaped white pills coated in sugar found at the bottom of their children's Halloween bags. Many of these parents confiscated these pills, and they began trying to figure out what these pills were and where they even came from. And that was when many started connecting the dots, realizing that these pills in their children's bags were ones that had come from the home of one of their very own neighbors, William Vincent Shyne. Now, William was a known and relatively successful dentist in the community. He had moved to the neighborhood just a few years back, sometime around 1952 or 1953, and he genuinely was a quiet, to himself, yet well-respected person in the community. And because of this, parents just found it odd that it appeared that these strange pills were coming from his home. They needed to get to the bottom of this situation, and so they devised a plan. They had gathered a few of the older children in the neighborhood, and they told them, look, we're going to give you some empty Halloween bags. What I need you to do is knock on William's door and go collect some candy from him. So after instruction, the older kids walked up to the home, empty bag in hand, knocked on the door, yelled trick or treat, and collected some candy from the man alongside a woman who was at the home. When the kids brought the bags home, parents inspected and noticed lollipops inside. But after taking a closer look, lo and behold, they in fact noticed more pills inside the bag. They immediately called the police, and it didn't take long for 16 separate complaints to be filed against William. Police headed to William's home with this information, but he denied all involvement, and just based on looks, they weren't able to determine what the pills were, but they did acknowledge that they looked a bit off. So the police just left him alone for that night, and they collected the pills to do some laboratory analysis on them. And might I tell you, they most definitely found out that these pills were not a sweet treat. In fact, they were far from. These pills, which appeared to be manufactured by a pharmaceutical company, weren't candy, but instead were actually aloe pills. And what's significant about aloe pills? Well, before being banned for use in 2002 by the FDA, these aloe pills were actually used as laxatives. And these laxatives weren't just found in 1, maybe 2, or even 3 homes. No, these laxatives were found in 250 homes, with the police recovering 450 pills. It took just one day for news to break across the community, and people were livid. They started calling his dental office, his nurse was receiving all types of threats, and for those next few days after Halloween, William was absolutely nowhere to be found. Eventually, police had received a tip at the last minute, and they found out William had canceled a flight for an elk hunting trip he was going on with a group of people in the Bitterroot Mountain Range of Idaho, and they discovered that for days, William had been out in the woods of the range in contact with nobody else. All the while he was gone, a 53-year-old Veterans Hospital nurse named Hazel Engelby, who was a good friend of William's and was seen picking up his dog on November 3rd, just a few days after Halloween, was arrested and charged with a misdemeanor before being released on $1,050 bail, which is about $11,000 today. And soon enough, after many days of being out in the woods, on November 9th, William had finally left the mountain range in his car before surrendering to police on November 11th and shortly posting bail. Both Hazel and William denied that they were involved in handing out any sort of laxative pills. But on January 23, 1960, William was found guilty of outraging public decency and was subsequently sentenced to 6 months in jail, as well as a $500 fine, or about $5,400 today. And his sentencing was eventually suspended to 4 months in jail, followed by 2 years of probation and a $252 fine, or $2,700 today. Whereas Hazel had all charges dropped against her. After appearing before a dental board that next year on February 17, 1961, William was also found guilty of unbecoming conduct and was placed on probation for 2 years, thus keeping his dental license. Nonetheless, this scandal wouldn't be it for William, because just a few years later, on December 17, 1963, he was actually arrested at his dental office for insurance fraud regarding bills he made to insurance companies on procedures he never performed. And despite pleading not guilty, on September 12, 1964, he was given a 6-month suspended sentence, was placed on probation for 1 year, and even eventually spent 2 months in county jail after violating his probation. William lived at that same Fremont home for the rest of his years until passing away on November 2, 2007. While this was an event that truly opened the eyes of many to children having their candy tampered with or their bags messed with, it wouldn't be too long after this occurred when something like this would happen again, but this time with an agent much more lethal, possibly even deadly. Long Island, New York, October 31st, 1964, 47-year-old Helen Pfiel spent Halloween night at home handing out treats to the neighborhood kids. There was one problem she had, though. Helen couldn't help but notice that there were a lot of older kids trick-or-treating that night, and she was quite frustrated by this. She believed that Halloween was a younger kid tradition. So despite having teens of her own at the time, 2 boys aged 15 and 16 who were also out trick-or-treating, Helen handed out 19 arsenic-based ant traps labeled with the ominous word poison, in addition to giving out metal mesh scrubbing pads and dog biscuits to unsuspecting teens. Helen and her husband excused her actions as being a joke, but police rightfully referred to this as a crime. Helen was soon arrested, she was admitted to a mental institution, and she faced 2 years in prison for child endangerment. Fortunately, no child was physically harmed in this case, but while this wouldn't leave a physical toll on any children, this would leave a significant mental toll. And this case would be a key event in prompting the fear many had regarding children's candy being tampered with deadly material during Halloween. Those treats may be tricks. A New York Times article published on October 28, 1970, reporter Judy Clemers-Rudd raised a warning to parents, stating, quote, "Those Halloween goodies that children collect this weekend on the rounds of trick-or-treating may bring them more horror than happiness." And eventually, these concerns of candy bringing more horror than happiness would lead to the infamous term Halloween sadism. Halloween sadism is a term that was first coined in 1974 by Richard Trudeau in a magazine article titled Holiday for Sadists, and it refers to, quote, "the practice of giving contaminated treats to children during trick-or-treating." 1985, The Razor Blade and the Apple, The Social Construction of Urban Legends. Co-authors Dr. Joel Best, a professor of sociology and criminal justice known as the leading authority on Halloween sadism, as well as Gerald T. Hariuchi. In this paper, they review news stories from 1958 to 1983 to, quote, "examine the widespread belief that anonymous sadists give children dangerous treats on Halloween." The 1980s and 1990s were 2 peak decades for concern around Halloween sadism, and this has been pointed out as conveniently overlapping with the satanic panic, which refers to, quote, "unsubstantiated cases of satanic ritual abuse starting in the United States in the 1980s. A Vice article in particular points out this overlap of peak Halloween sadism concerns with the peak of the satanic panic in the late 80s and early 90s. In the same article, it was pointed out that the alleged methods of Halloween sadism that concerned people at the time varied greatly depending on current events that were happening during that era. For example, in 2001, shortly after the 9/11 attacks, a rumor was circulating that a terrorist attack was going to happen on Halloween. According to a Snopes article from October 2001, a woman claimed to have received a concerning letter from her boyfriend who was living in Afghanistan and who had disappeared a month prior to when she received or announced these claims. She said that on September 10th, he had sent her a letter warning her to not get on flights or go to malls on 9/11 or on Halloween due to alleged attacks planned for those days. This claim spread like wildfire, and people became worried a mall was the next target for a terrorist attack. However, after the FBI looked into the claim, they determined that the alleged threat was not credible. Nonetheless, children actually claimed to have received sweets and baked goods with terrorist messages in them during that Halloween. Not only is it dependent on the era, but there's also likely a paternal component to it. I'm sure for parents, seeing strangers hand your child food to consume can be anxiety-inducing, especially in larger communities where people might be less familiar with their neighbors. Many would refer to this idea of Halloween sadism as a myth. However, in 2016, Joel Best told Vice the following quote, "Reporters like the word myth because it's only 4 letters long. But folklorists prefer to say legend. A legend doesn't mean that something is false. A legend means that it's mostly communicated informally. And referring to the fear many have of a case of Halloween sadism occurring each year, Joel stated the following quote, "One of the remarkable things about our age is the extraordinary number of apocalyptic scenarios that we have. It's the greatest thing in the world you can be afraid of because you only have to be afraid of it for one night a year." There became this growing concern that Halloween candy would be a common site for malicious tampering, and many remotely related cases, even with having nothing to do with trick-or-treating, eventually became main culprits in inducing the fear of Halloween candy for many. Chicago, Illinois, September to October 1982, an entire city was left frozen in fear after several bottles of extra-strength Tylenol were tampered with, leading 7 individuals to pass away. This was a time before safety seals were used for such medications, and after the string of unusual passings, investigators would discover that these tainted capsules were laced with powdered potassium cyanide, a colorless, scentless powder that looks very similar to salt. Without buyers or clerks noticing, somebody had opened boxes containing bottles of Tylenol, opened up the capsules of Tylenol, placed cyanide inside of the capsules to then put the capsules back in their bottles, and placing the bottles back into their boxes to place right back onto the shelves of the stores affected. The Tylenol poisonings easily became one of the most known examples of poisoning or tampering that occurred throughout the USA. The fear and paranoia that it ingrained in people still lives on today and resulted in the creation of the safety seals we all know today. There was a huge media frenzy surrounding the case as headlines focused on and shared information about the investigation, victims, warning the public about other potential dangers. Cyanide in Tylenol causes deaths, a Daily Pantograph headline from October 1st, 1982, notifying individuals of a recall of Tylenol bottles with the serial number of the bottles affected in the case. And multiple reports would go around with police and health departments cautioning people to avoid their Tylenol. This case would cause lots of fear, not just across Chicago, but across the country, and it compounded the pre-existing paranoia regarding the potential for laced Halloween candy. In the aftermath, American grocery stores claimed that candy sales were down around 20% from the year before. The Chicago mayor advised residents to give out money or small toys instead of candy. Some subdivisions advised handing out coupons, and many cities ranging from Vineland, New Jersey to small towns in Ohio, Pennsylvania, and Massachusetts even canceled their Halloween that year out of fear of candy being tampered with. Even today, there are still concerns regarding candy being tampered with chemicals or drugs. For example, in 2021, there was fear over what people thought to be candy laced with THC, when in actuality, the thing people were worried about were actual labeled edibles sold by edible companies. Throughout the years, there had been many concerns over cases of Halloween fatalities which were initially believed to be caused by trick-or-treating, when in actuality, a lot of these deaths were misattributed regarding what really happened. Well before the Tylenol poisonings, on October 31st, 1974, 8-year-old Timothy O'Brien was out trick-or-treating alongside his younger sister and his friend. During this night, they collected a lot of candy, which they brought home to enjoy as most kids would do. But as Timothy had eaten one of his Pixie Stix candies he collected, he immediately fell ill before subsequently passing away. They soon found out that these candy sticks had been opened, filled with powdered poison, and resealed before Timothy ate them. The thing is, his candy wasn't poisoned from a random stranger on the street. His candy was poisoned by his own father, Ronald Clark O'Brien. Ronald had filled the Pixie Stix candies with potassium cyanide, the same poison used years later in the Tylenol poisonings. Naturally, and rightfully so, the media was up in arms with this case, and Ronald eventually admitted that he'd attempted to poison all of his children, aiming to collect the life insurance policies he'd taken out on them just 30 days before Halloween. At the time, due to his policy, he would have been able to get up to $40,000 per child, which by the way is equivalent to about $255,000 today. Additionally, he admitted doing so in order to pay back his nearly $100,000 or about $638,000 in debts today. And also he did this to attempt to live a more comfortable life. Ronald would even admit during the investigation that he actually was attempting to use the paranoia around poisoned Halloween candy to attempt not being linked to the crime. In fact, to even further rely on the paranoia of many, he actually poisoned a Pixie Stix and gave it to one of his son's friends in an attempt to make it look less obvious. Ronald was arrested on November 5th, 1974. He was eventually found guilty and sentenced to death on June 3rd, 1975, before passing away by lethal injection on March 31st, 1984. Before it was discovered that Ronald had poisoned his own son, the community was described as being hysteric. Only the 5 pixie sticks related to Ronald were found to have tested positive for cyanide, but still, many parents were not letting their children consume any candy they'd collected whilst trick-or-treating, and the police urged citizens to turn over candy for testing if they haven't already thrown it out. Despite this case being more so a personal case involving a father and son who knew each other, this whole incident left an even greater fear around candy in relation to random poisonings happening during Halloween. And it left Ronald with 2 insidious nicknames, the Candyman and the Man Who Killed Halloween. Even now, many people remember or are misinformed on the case with misconceptions as to where the poisoned candy had come from. And it wasn't just poisoned candy that was a concern, because even before that, starting around 1967, things shifted from fears of having candy poisoned with drugs or chemicals to having fears of candy being contaminated by things like needles, pins, or razors. Specifically, there had been an uptick in concern that razors would be found in apples. In fact, this would actually lead hospitals to start X-raying children's Halloween candy. Candy X-raying initiatives have been around since at least the 1980s, and some still continue till this day. Just before Halloween in 1968, New Jersey actually passed a law prohibiting people from booby-trapping apples with razors by mandating prison terms for anyone potentially planning to do such a thing. During Halloween that year, there were reports of a total of 13 apples being found to have razor blades in them in 5 different counties of New Jersey. But eventually, after doing some more investigation, it was discovered that these cases were a hoax devised either by the children or by their parents. And it wasn't just New Jersey dealing with this concern, but even in Toronto, there's a CBC TV report from 1968 of Toronto police showing apples that have apparently been tampered with razor blades and turned in for investigation. After this, there soon became an influx of Halloween PSAs or public service announcements warning people about the possible dangers of candy tampering. For example, a Centron Corporation PSA from 1977.
If you don't know the people very well, don't go into their homes. Most people enjoy having trick-or-treaters come to their doors, but there are a few people who will do things to hurt kids. They might put sharp or hard objects in candy and apples, or they might put something on fruit or gum that could make you sick if you eat it.
And another Centron Corporation PSA from 1985.
But what do you do with all the treats you've collected? A lot of them are things to eat, of course, but you don't eat them all. At least not right away, that's for sure. And there might be some you won't want to eat at all. Get a grown-up to help you decide, or at least someone a lot older than you. You see, some people think it's fun to play tricks with your treats. Watch out for candy wrappers that have been torn or punctured. That might be a sign of tampering. There might be things in the candy. So break open candy bars before you eat them. Cut fruit into pieces before you eat it, just in case something's been stuck in it. Watch out for things that look like candy, but might be medicines or drugs, or even poisons. Don't eat anything that doesn't look right. If it looks funny, it might not be so funny if you ate it. Treats are so much fun to collect, it'd be awful to have them spoil your Halloween fun by making you sick.
And while there would be unproven reports made about cases like this occurring in the years after, there would eventually be one actual confirmed case of somebody tampering candy with metal objects. In 2000, 49-year-old James Joseph Smith of Minneapolis was arrested and charged with 1 count of adulterating a substance with intent to cause death, harm, or illness after putting needles in candy bars to hand out to children during Halloween. 4 teenagers reported to police that after receiving and biting into Snickers bars given out by James, they noticed there were needles inside. And when the teenagers noticed the needles were inside, they stopped eating it before any injuries occurred. However, although there was one 14-year-old boy who was pricked by a needle, it was reported that he did not need medical care. Additionally, 3 other children were reported as also being given these candy bars containing needles from James, but all in all, there were no serious injuries from this case. Although James was arrested, it was announced in December that year that he was not competent to stand trial, and I couldn't find anything on how this proceeded when he went to court 6 months later. With these concerns stemming from the alleged razor and apple reports, it became a thing for worried parents to bring in their children's Halloween bags to get x-rayed at hospitals with the idea that any metal objects that might be hidden in the candy, such as needles, pins, or razors, would be seen in the x-rays, stopping the child from accidentally eating it. But was doing any of this even effective? Well, studies and articles from 1980s and 1990s and even today all say no. In a study from 1988, it was found that nationwide hospitals were likely spending up to $800,000 to $1.4 million, which is equivalent to about $2.1 million and $3.7 million in 2024, just to get candy x-rayed during Halloween. 3 hospitals alone in 1986 incurred costs around $1,600, which is equivalent to about $4,700 today, during just that one Halloween night. On top of the cost, the study mentions that in providing these X-raying initiatives to screen Halloween candy, there had been shown to be not only a stalling in progress in actual cases, but there were backups in the hallways of the hospitals, and there was an excess amount of people clogging the emergency room, which is where they're told to enter to get their candy scanned. And another qualm with this is that the scans can only test for metals in the candies, not chemicals, meaning they may not even be able to truly see if it's safe if it has anything else in it. All in all, from the 1,063 candy bags x-rayed from this study, none were found to contain radiopaque foreign bodies. Likewise, in a study from 1993, they reported that across 5 hospitals and 2 immediate care centers, 450 bags of candy were scanned, and out of these bags, no radiopaque atoms were found. In fact, one of the facility's x-rays wasn't even able to pick up very small objects in the scans. And out of all the facilities, only one facility made people sign a liability waiver regarding the safety of the candy. Ultimately, both of these studies showed that the scanning or x-raying of candy is both expensive and not effective. But even with candy screening being shown to be ineffective from these studies, dating from the 80s and 90s, it still continues to this day. In 2015, the Eddy County Courthouse offered people to get their Halloween candy scanned that year in Carlsbad, New Mexico. The thing with Halloween sadism is that while there has been cases of Halloween candy being tampered with, like the ones discussed previously, there's never been any recorded cases of serious injuries or fatalities that have occurred from strangers tampering random children's candies. What typically tends to happen, though, is cases like Timothy O'Brien's being misattributed or remembered as cases of random Halloween poisonings. As of 2019, Joel Best reported to CBC that since 1958, he has evaluated around 200 reported cases of candy tampering in the US and in Canada. However, he stated that, quote, the attempts to systematically follow up on all reports concluded that the vast majority were hoaxes. Further explaining that some of these instances were as a result of the kids tampering with the candy, possibly for attention, or even adults or friends tampering with candy to commit a prank. All in all, though none of these candies have resulted in anyone passing away or anyone suffering serious injury, what instead has happened is that since the idea of Halloween sadism has been a known thing in the general population, there have been 5 cases of children who have passed away, which many initially associated and even still do associate with being a result of candy tampering from strangers, when in actuality, these cases really are misattributed and are not as a result of strangers randomly giving children poisonous candy. Also, the only 2 cases of misattribution relating to drugs was Timothy's case, as well as the case of 5-year-old Kevin Toston, who passed away in November 1970 after consuming heroin he found at a relative's home. Kevin's parents initially believed that he passed away from contaminated Halloween candy, but the investigation soon revealed that he'd actually passed from a heroin capsule that he consumed belonging to his uncle. And kind of like Ronald O'Brien, it's been reported by some sources that the relatives attempted to cover this up by sprinkling heroin onto Kevin's Halloween candy, making it look as though it was tampered with. Joel Best referred to these misattributions, stating, quote, people desperately want to believe in the existence of this villain, a perverse stranger waiting for the perfect opportunity to poison an innocent child. Say this to say, while still absolutely disgusting, these weren't random attacks from strangers. These were attacks by people these kids knew and should have been able to trust. With the extremely low rate cases like this actually occur at, the concern of having Halloween candy randomly tampered with likely shouldn't be as much of a worry, especially as we mentioned earlier regarding Rainbow Fentanyl. What is, however, cited as being a reasonable concern regarding these drugs are scenarios where somebody happens to ingest these drugs on accident. And what should most definitely be a concern for everyone is the problem our communities have with the opioid crisis in general. The opioid crisis, which is also referred to as the opioid epidemic, is a major public health emergency affecting both rural and urban communities in the States. And although we'll mainly be discussing data from the United States, opioid use is a problem that is affecting communities worldwide. Though it wasn't officially listed as a public health emergency in the USA until 2017, the opioid crisis began around the late 1990s with many records of statistics beginning in 1999, and it's still majorly ongoing today. According to the CDC, there has been 3 distinct waves or phases that have characterized the crisis so far. Wave 1 in the 1990s is described as the overprescription wave due to an increased prescribing of opioids leading to a rise in overdose fatalities. This overprescription of opioids in the 1990s made it more likely for people to develop an addiction to them or even become dependent on them whilst being treated, and it eventually led to misuse of opioids, i.e. using it in a manner that was not prescribed. becoming much more common. Wave 2 in the 2010s is described as the heroin use wave, as heroin use became more popularized, causing an uptick in heroin-related fatalities. And Wave 3, which started in 2013 and is still ongoing today, is the synthetic opioids wave, where there's an uptick in synthetic opioids, most notably including illegally made fentanyl, or IMF. Synthetic, by the way, is referring to the fact that it's a human-made substance as opposed to a natural drug, which is derived from natural substances such as plants or animals. The CDC has reported that between the late 1990s and now, more than 560,000 people have passed away due to opioid overdose, with the death rates ramping up each year. And around 450,000 of these cases happened between 1999 and 2018. Approximately 69,000 of these opioid deaths occurred in 2020, and 82% of these cases involved synthetic opioids. And while not all of these cases are fatal, in 2016, around 290,000 people in the States were hospitalized or visited the emergency room for opioid poisoning. In the 12 months between December 2020 and December 2021 alone, about 107,622 people passed away due to opioid overdose, with around 66% of these passings coming from synthetic opioids. This major uptick at that time is often linked with the COVID-19 quarantine, which also saw an uptick in things like drinking, smoking, and other substance use. According to the National Institute on Drug Abuse, or NIDA, it's been shown that males are more likely to pass away from opioid overdoses in comparison to females. And there's also been studies which have shown gaps in mortality rates amongst different races. A 2023 study in Virginia found that major gaps in mortality rates between different races were and are continuing to grow. Specifically, the study found that Black males were 1.5 times more likely to pass away from opioid overdose than white males, and they concluded from the study, quote, "There are widening racial disparities in opioid mortality. Untreated mental health disorders are a major risk factor for opioid mortality. Findings show pathways to address inequities, including early linkage to care for mental health and opioid use disorders. This analysis shows the use of comprehensive socioecologic data to identify the precursors to fatal overdoses, which could allow earlier intervention and reallocation of resources in high-risk communities." Additionally, this study also focused on factors such as access to healthcare, community characteristics, specifically regarding urban versus rural areas, and various characteristics of individuals in the areas surveyed. For example, relationship status, education level, disabilities, and many more. The primary results they found was that there was a positive association between fatal overdoses in people who were disabled, people who are divorced, those in urban and suburban areas compared to those in rural areas, and in people who'd been prescribed opioids before. You might see slightly different numbers cited from source to source because a lot of the stats are dependent on factors such as age, race, sex, or whether it's in an urban or rural community. For example, in a 2022 study, the CDC reported that in 2020, Native Americans had the highest age-adjusted mortality rates for opioid overdoses in both rural and urban areas. Whereas when looking at just race, Black Americans had a much higher mortality rate when in urban areas in comparison to Black Americans in rural areas. This was also shown in a 2023 study in New York City, which found that the mortality rate for opioid overdoses per 100,000 people was found to be the highest in Black residents, followed by Latinx residents, and then followed by white residents. Which, based on the stats from the CDC showing that Black Americans have a higher mortality rate in urban areas, this checks out. Same with sex. In 2020, males had about twice a higher mortality rate in both urban and rural areas compared to females. But when looking at just sex, females had a higher mortality rate in rural areas in comparison to in urban areas, whereas males had a higher mortality rate in urban areas in comparison to rural areas. It also is state dependent because even though urban counties were reported as having a higher mortality rate than rural counties, 8 states had rural areas with a higher mortality rate than their urban areas, whereas 23 states had urban areas with a higher mortality rate than their rural areas. And then 16 states had similar rates for both urban and rural areas. So just based on these factors, you might see different studies with different numbers cited, but that's all a result of what's typical for that area. And for the most part, the stats don't seem to vary that much. As mentioned, the main drugs involved in the opioid crisis include prescription opioids, heroin, and illegally made fentanyl, which in recent years has accounted for the most overdose fatalities. However, of these drugs, one in particular that has been discussed as being a concern in 2022 is Rainbow Fentanyl. Rainbow Fentanyl is an extremely strong synthetic opioid that starts as a powder and is incorporated into pills. The rainbow part of the name for this drug comes from the bright colors often mixed into the batches by the suppliers who make it. Although fentanyl has been an issue since the early 2010s, Rainbow Fentanyl specifically was first reported to the DEA in February 2022, and it soon became a major issue, leading to many states releasing official warnings for the substance in September 2022. The DEA warned that year that Rainbow Fentanyl had been found in 26 states, and states that subsequently put out warnings about the drug included New York, New Jersey, Texas, California, Oregon, Florida, Pennsylvania, Colorado, and Maryland. Even though it's been reported that in 2022, the highest mortality rate from drug overdoses occurred in those of the 35 to 44 age range, a study has shown that between 2010 to 2021, adolescents of the 14 to 18-year-old age range had experienced a greater relative increase in mortality rates from drug overdose in comparison to the overall population. And this increase is attributed largely in part to fatalities involving fentanyls. It's been reported that the increase in fatalities in teens is not as a result of an increase in illicit drug use, which, excluding cannabis, has actually drastically fallen in the past 2 decades, but that the increase in fatalities are instead the result of drugs becoming more deadly due to them being contaminated or laced with fentanyl. Thus, this data suggests that it's not that drug use is becoming more common amongst young people, but that drug use is becoming more dangerous. And census data has shown that in teens 15 to 19 years of age, this increased overdose mortality rate from unintentional fentanyl use has still remained elevated well into 2022. Now, it's important to note that there are many different instances in which someone might end up using a drug such as fentanyl. According to the National Institute on Drug Abuse, there are a few general reasons why one might start or continue using drugs. These include to feel good, to feel better, to do better, and curiosity and peer pressure. It's also important to note the use of drugs can possibly lead to a condition called substance use disorder, or SUD, which, according to the National Institute of Mental Health, is, quote, a treatable mental disorder that affects a person's brain and behavior, leading to their inability to control their use of substances like legal or illegal drugs, alcohol, or medications. Symptoms can be moderate to severe, with addiction being the most severe form of SUD. The term substance use, by the way, encompasses the continued use of alcohol, illegal drugs, or misuse of prescription or over-the-counter medications. However, in this case, we'll specifically be referring to opioid use. Also, while substance use can lead to substance use disorders, this is not always the case. According to the 2023 United States National Survey on Drug Use and Health, or NSDUH, 5.7 million, or 2% of Americans aged 12 and older, had an opioid use disorder that past year, and 8.9 million, or 3.1% of Americans aged 12 and older, misused opioids that year. And while there isn't an exact known cause of substance or opioid use disorder, some common risk factors include things like genetics, environmental factors, or even other mental disorders. Fentanyl is a strong opioid pain medication that can be pharmaceutically made and prescribed by a doctor under supervised medical use. In this case, the use would be for medication, as opioids are known commonly as pain relievers and are often prescribed in the treatment or relief from both physical conditions and mental conditions. But then when we get to the non-prescribed or illicit uses of fentanyl, this can include misuse of prescribed fentanyl, such as using in a manner or dose that wasn't prescribed, using someone else's prescription, or even using illegally made fentanyl recreationally, like at parties, for example. It's not uncommon for fentanyl to be taken both on purpose or even accidentally in recreational settings. Which then brings us to lacing, which is one of the common concerns regarding especially young people, because in a lot of these cases, they're unintentionally consuming fentanyl by taking another drug that's been laced with it. It's been reported that it's not uncommon for certain supplies of drugs to be laced with another drug in hopes of getting the user addicted to a different and sometimes more expensive drug, which of course makes things much more dangerous for the person using it. As for medication, it's also not uncommon for people with both mental and physical chronic illnesses to seek out substances as a form of self-medication for pain relief when they're unable to get real treatments or are shrugged off by doctors. In an attempt to not contribute to the overprescribing of opioids, which is cited by experts as having played a role in the current opioid crisis, many doctors in recent years have been extremely cautious in their prescribing of opioids as to not give them out to those they deem do not need it. But the downside of this is that this creates struggles for those who genuinely do need them, but are unable to find a physician willing to prescribe them with it. And despite the American Medical Association, or AMA, reporting a 44.4% decrease in opioid prescriptions from 2011 to 2020, including a 6.9% decrease in just 2019 to 2020, there still is a nationwide increase in fatalities from opioid overdoses, mainly due to illicit use of fentanyl. Between 2016 and 2022, synthetic opioids, most notably fentanyl, were the most common cause of overdose fatalities in the United States. And in New York City, 80% of overdose fatalities in late 2022 were due to fentanyl. So, seeing how dangerous such a drug can be, this makes it no surprise that many were concerned to learn about it, in some cases being disguised in candy packages. And this brings us back to that very warning issued from the DEA regarding concerns of rainbow fentanyl being given to children and the fears this soon caused for many regarding Halloween. While there were indeed cases of busts that have occurred where rainbow fentanyl was found inside candy packages, and while this did lead to many people being concerned this would be an issue during Halloween, in an NPR article, drug policy experts agreed that fentanyl wasn't a threat to Halloween bags that year. Even Ann Milgram, the DEA administrator herself, stated during a TV interview with Fox on September 28, 2022, that the DEA hadn't seen any connections relating Halloween and rainbow fentanyl.
Moms and dads everywhere are really worried that their kids are going to end up with one of these bags of nerd candies and they'll find their child dead. What should they know?
So this is one of the most important things we talk about. First of all, we have not seen any connection to Halloween. And I want to be very clear. If we see it, I promise you have my commitment. Any credible evidence, we will come out and we will tell you.
And Ann Milgram further went on to explain that what they instead are mainly concerned about is how the drug is being spread on social media and how this in particular can target the younger demographic.
We are not seeing it in elementary school. We have not seen it with Halloween candy. But the bottom line is that this is all over social media. And so we know it's out there. Parents, we are begging families and parents to talk with their loved ones and to talk with their children. Never take a pill that wasn't prescribed directly to you. Help your child come up with an exit strategy. What do you do if a coach or your best friend or another member of your family offers your kid a pill? What should they do? No legitimate pharmaceuticals can be sold on social media, so make sure your kids know that. And finally, just understand that many people who are dying of fentanyl poisoning had no idea that they were taking fentanyl, and the cartels don't care.
In all the reports the DEA did issue, they never once associated rainbow fentanyl with Halloween. In that first report regarding rainbow fentanyl, they stated, quote, "This trend appears to be a new method used by drug cartels to sell highly addictive and potentially deadly fentanyl made to look like candy to children and young people." But as people read that warning from August, and as different news and media sources continued to cover it, it ended up changing from this just supposedly being a drug made to look like candy online to entice kids to being a drug people were allegedly going to be giving out to children during Halloween.
This is the time of year kids are putting the finishing touches on their costume and thinking about that candy they're going to collect on Halloween. The Drug Enforcement Agency, though, says parents should take that extra step this year to make sure that candy is safe.
This epidemic is exploding, which is why this Halloween, let's join forces and look out for one another.
Despite the DEA themselves not mentioning Halloween, something that drug policy experts had pointed out is that in the warning, the DEA also never provided evidence demonstrating cases of rainbow fentanyl specifically being made to look like candy to sell to children. They just said that it appears to be a new method. Experts also brought up how that just a couple months later, on October 4th, 2022, when the DEA issued an alert regarding rainbow fentanyl being found in Legos, the DEA themselves acknowledged that the rainbow fentanyl wasn't necessarily being concealed in toys as a method to sell to children, but that instead it was concealed as a smuggling tactic to, quote, deter law enforcement traction. And as you can see from the Fox interview, Ann Milgram herself brought up that one of the true main concerns of the drug, in addition to it being on social media, is of it being made with different colors to look like other prescription medications, which epidemiologists and street drug scientists also agreed with when speaking to NPR, saying, quote, "Oftentimes, colors are also used to mimic legitimate prescription medications." Rainbow fentanyl is indeed a dangerous substance that is affecting young people. However, as we can see from research and investigations, rainbow fentanyl has not been shown to be an issue affecting children regarding their Halloween candy, nor do experts suspect that it's being used to entice children because of it apparently looking like candy. And overall, there's a general consensus that the issue instead arises more from rainbow fentanyl looking as if it's a less harsh drug, notably prescription medications, prompting people, specifically young younger demographics to unknowingly ingest it. Now, even though this is something the DEA themselves later acknowledged was their main concern, many people have speculated that the whole warning in the first place of relating Rainbow Fentanyl to candy might have been done with some hidden motives. Specifically, people have argued that the warning might have been done as an artificially induced moral panic aimed at exploiting the worries many already have regarding Halloween sadism in an attempt to cause fear and to further stigmatize those suffering from opioid use. Because even though the DEA themselves haven't explicitly related the drug to Halloween, there has been specific references people have cited contributing to their skepticism of the initial warning. Most notably, there had been issues in the past where the DEA released information that wasn't true regarding fentanyl, which contributed to several misconceptions for many. In 2016, the DEA released a statement warning people, stating, quote, "Just touching fentanyl or accidentally inhaling the substance can result in absorption through the skin, and that is one of the biggest dangers with fentanyl. The onset of adverse health effects such as disorientation, coughing, sedation, respiratory distress, or cardiac arrest is very rapid and profound, usually occurring within minutes of exposure." And that next year, on June 7, 2017, they released an updated video regarding the topic. In the video, alongside this statement, showed an image of a tiny, allegedly lethal amount of the drug beside a penny to show the comparison of conveying that incidental exposure to just a little amount could potentially cause fatal effects. When this was announced, many people, including first responders, were concerned to learn this. And later on, there would even be videos posted online depicting alleged overdoses from officers who've encountered fentanyl while on duty. While first responders do, of course, encounter all types of dangers while on duty, when experts from the American Academy of Medical Toxicology and the American Academy of Clinical Toxicology reviewed these claims, they actually released a joint statement on August 25th, 2017, clarifying that, quote, "It is very unlikely that small unintentional skin exposures to tablets or powder would cause significant opioid toxicity, and if toxicity were to occur, it would not develop rapidly, allowing time for removal." Okay, so if the toxicology experts debunk this claim, how does that explain those videos we just saw of officers allegedly overdosing on fentanyl? Well, after reviewing these videos, many medical experts have come forward claiming that the reactions of those in the video aren't reactions that are consistent with what would occur during an opioid overdose.
They say it's not consistent with that of an overdose.
She's walking out of the car, right? When you have a fentanyl overdose, when you have an opioid overdose, you don't have postural tone. You're not up. You're unconscious. Your breathing is slow. Your eyes are closed. Right? We see her. She's sitting up at one point. She says, "My chest hurts so bad." Again, opioid toxicity, you're asleep. You're unconscious.
You've seen TV where they put out a line or you got to have a good amount to get in your body. You're not going to get a little powder on your hand and put it in your nose. You're not going to get sick from that.
Many experts argue that in the videos such as the ones above, the officers are displaying not what looks to be an opioid overdose, but instead some kind of stress response. Leo Beletsky, a law and health sciences professor, explained the following.
It is technically impossible to touch fentanyl powder and feel any effects of it, let alone overdose. The visible symptoms, what we see from the video, could be consistent with a panic attack. It could be, any number of things. People have, fainting events all the time.
Some researchers claim that the reactions seen in the cases from the videos above can be explained by something called the nocebo effect. The Pharmacology Research and Perspectives Journal explained that, quote, "The nocebo effect refers by definition to the induction or the worsening of symptoms induced by sham or active therapies." This is the opposite of the placebo effect, with the difference being that the placebo effect results in positive expectations leading to beneficial outcomes, whereas the nocebo effect results in negative expectations leading to harmful outcomes. Dr. Ryan Marino, a medical toxicologist and addiction medicine specialist, explained the following.
If I told you day in and day out that if you are near fentanyl, if you touch fentanyl by accident, you're going to overdose, you're going to die, then the second you come into contact with something that you think is fentanyl or you confirm is fentanyl, that is going to cause a very severe fear, panic reaction.
Now, Officer Courtney Bannock from the video above claimed that if this wasn't an opioid overdose, how else would that explain her recovery after being given Narcan, aka Naloxone? Well, Dr. Andrew Stolbach, medical toxicology expert, explained the following.
It's not consistent with Narcan, with Naloxone. For you to get it and then have a good response and wake up, and then immediately go back down again. That's just not consistent at all.
And Dr. Lewis Nelson, another medical toxicologist and addiction medicine specialist, explained the following as well.
Because it seems so real. And I think these are all legitimate concerns. I don't think anybody's trying to pull a fast one here. I think these people really believe they're exposed because this is what they've been told happens.
And regarding the video of Deputy David Five-Eye, Dr. Marino explained the following.
This video is not an overdose. It is not possible to overdose on fentanyl in this way.
So as you can see, doctors and experts say that these reactions, no doubt, are medical emergencies. However, they say these reactions are not ones that look to be consistent with an opioid overdose. And experts believe that misinformation, for example, from things like the 2016 statement shared by the DEA, contributes to the misconceptions held by many first responders, including law enforcement officers and even emergency medical services, that they could overdose just by simply touching incidental amounts of fentanyl. After toxicology experts set the record straight regarding the video posted by the DEA, professionals from countries such as Canada and the UK made sure to update their information for the first responders with correct information regarding the true toxicity risk from incidental exposures of fentanyl. And while the DEA did in fact retract their original statement from 2016, the video they posted on the topic in 2017 is still available to view online.
It is extremely dangerous to users and to those who simply come into contact with it. If you're a first responder, that could be you.
Even in May of 2022, the CDC's National Institute for Occupational Safety and Health, or NIOSH, was called out by health experts regarding a video they had on their website in which an officer's medical emergency was attributed to fentanyl exposure with little evidence showing that that was the case. Just 2 months after experts at MedPage Today reported on the misleading video, on July 14, 2022, it was announced that after a, quote, review process of NIOSH content for first responders working around illicit drugs, the CDC removed the video, citing, quote, concerns that parts of this video may mischaracterize the risks facing these workers and that it fails to share other potential causes of the health effects seen in the video. It's important to note there are transdermal fentanyl skin patches pharmaceutically made and prescribed by doctors to help relieve severe and persistent pain. These are designed to be absorbed through the skin to deliver medication. And it's important to note small amounts of illicit fentanyl use is dangerous and can cause an overdose. But regarding just accidentally touching trace amounts of street fentanyl, experts say it's extremely unlikely for one to overdose on the drug in this way. Still, nonetheless, this doesn't negate the fact that this is a dangerous drug and that caution should be taken during a suspected potential exposure. When one suspects an encounter with a drug like fentanyl, there are precautions experts recommend to help keep people safe. The DEA has posted a document titled Fentanyl, Safety Recommendations for First Responders, with, quote, scientific evidence-based recommendations to protect yourself from exposure. In this document, they acknowledge that, quote, misinformation and inconsistent recommendations regarding fentanyl have resulted in confusion in the first responder community. And they go on to list the scientific and evidence-based recommendations, including wearing gloves if the presence of fentanyl is suspected, avoiding actions causing the powder to become airborne, using a properly fitted NIOSH-approved respirator mask, wear eye protection and minimize skin contact when small amounts of suspected fentanyl are visible and may become airborne, and following your department guidelines if there's large amounts of suspected fentanyl. Experts cite that there are many problems that can arise from misinformation being spread regarding drugs such as fentanyl. Most notably, the fact that the misinformation from the DEA led first responders to believe that simply touching trace amounts of fentanyl is enough to cause fatal damage is concerning because this can easily lead to people not getting the correct care they need to save their lives. There's already a stigma that affects those who use drugs, and many have even described avoiding healthcare professionals even when they're sick, just due to the discrimination and abuse they've reported experiencing at such facilities. In an opioid overdose, it's critical that life-saving methods are applied as soon as possible, including the administration of Naloxone and application of rescue breathing techniques. According to the National Institute on Drug Use, Naloxone is a medicine that rapidly reverses an opioid overdose. It is an opioid antagonist. This means it attaches to opioid receptors and reverses and blocks the effects of other opioids. Naloxone can quickly restore normal breathing to a person if their breathing has slowed or stopped because of an opioid overdose. But naloxone has no effect on someone who does not have opioids in their system, and it is not a treatment for opioid use disorder. You may commonly know naloxone as Narcan. However, Narcan was just the brand name of naloxone when it was first approved. There are now other brands and formulations of naloxone, which is the generic name for the medication, so I'll be referring to it as that going forward. There are two forms of naloxone administration which have been approved by the FDA. One is injectable and two is a prepackaged nasal spray, which was first actually approved by the FDA on March 29, 2023. According to the World Health Organization, there's a combination of 3 signs and symptoms that can be looked for to identify an opioid overdose.
Pinpoint pupils, unconsciousness, and difficulties with breathing.
When somebody is experiencing an opioid overdose, their breathing rate decreases significantly, and this causes a lack of oxygen being supplied to the body. In these emergencies, it's critical that naloxone is administered as soon as possible to reverse the effects of these opioids before performing rescue breathing techniques. If first responders have an exaggerated misconception of the risks associated with fentanyl exposure, this could create a hesitancy to help somebody in need, and this further contributes to the stigmatization of those who use drugs, viewing them as dangerous or even toxic beings that one has to avoid touching. And this especially doesn't help when it's actually been cited in a study that, quote, while officers view themselves as adequately trained in administering naloxone/Narcan, almost half, 43% believe there should be a limit on how often someone who overdoses receives Narcan, and the majority, 83%, view naloxone/Narcan as providing an excuse to continue drug use. So when you have people suffering from opioid use see how they're viewed by healthcare professionals and first responders, it leads to a sense of hesitancy for many avoiding calling for help in emergency situations out of fear of how they'd be treated. Now, on the other hand, like mentioned, there are people who have objections regarding the distribution of naloxone to those who use opioids, as they believe that doing this just encourages continued use of such drugs. The thing is, studies have actually demonstrated that overdose education and naloxone distribution, or OEND programs, were shown to cause a reduction in self-reported use in communities. And many studies have shown that these OEND programs have shown an increase in the reversal of potentially fatal opioid overdoses. The National Institute on Drug Abuse conducted a review where they shared a study reporting that, quote, naloxone distribution was predicted to prevent 6% of overdose deaths, 1 for every 227 naloxone kits distributed. And they shared a study which reported that communities that had OEND programs implemented had an opioid overdose fatality rate 27 to 46% lower than communities that did not. Many pharmacist training programs have explained it like this. Naloxone is like a fire extinguisher. You may not expect a fire to ever happen, just like you don't expect an opioid overdose, but it's always good to have a fire extinguisher or naloxone around just in case there's an accident or an emergency. They've even used the examples of an EpiPen. You don't expect an allergic reaction, but in the scenario where you do experience one, it's good to have an EpiPen just in case. Essentially being, it's better to have it and not need it than to need it and not have it. There will always be varying opinions people have regarding the opioid crisis, who's at fault, and what can be done to fix it. That's a whole topic in itself that's extremely complex. At the end of the day, when just looking at this from a medical healthcare standpoint, what it boils down to is no human being should feel like they can't get medical care in an emergent situation. This is even stated in the World Health Organization's constitution that health is a fundamental human right, and experts have stated, quote, while the harm that could result from increased opiate use is a legitimate concern, this potential harm would have to be weighed against the potential for naloxone to prevent overdose deaths. It is unethical to allow a narrow focus on the harms of drug use to overshadow an opportunity to save human lives. So going back to what we were discussing with the concern of rainbow fentanyl being placed in children's Halloween bags, from everything researchers have shown, while fentanyl being in Halloween bags isn't necessarily a concern, an actual concern is fentanyl affecting young people, period. In 2022, Dr. Joseph Palomar, an associate professor in the Department on Public Health, told CNN the following, quote, I think the big difference people are concerned about is with regard to accidental ingestion. People are worried that their kids will take one of these pills thinking they're another drug or even thinking that they're some sort of candy. I don't think the color of the pill greatly increases danger to people who don't use fentanyl, but there is always a possibility of someone who uses fentanyl leaving their pills around in the reach of children. We need to keep in mind that these pills cost money, so people aren't going to be throwing them on the ground for kids to find. I don't think people will be giving these pills out as Halloween candy. There is an opioid crisis, and young people in particular are vulnerable to it. But experts say that instead of worrying that strangers are going to fill Halloween bags with drugs, it probably would be more of use to worry about making sure there's education and support for young people regarding opioid use. And instead of hospitals putting money towards X-raying candy, for example, those resources can be put towards initiatives to help prevent the true issue of opioid use occurring in communities. For example, from the Evidence on Strategies for Addressing the Opioid Epidemic section of the Pain Management and the Opioid Epidemics book, researchers have cited the evidential benefits of implementing strategies such as improving access to drug take-back programs where individuals are able to return drugs to pharmacies, establishing comprehensive pain education materials and curricula for healthcare providers, facilitating reimbursement for comprehensive pain management, improving the use of prescription drug monitoring program data for surveillance and intervention, evaluating the impact of patient and public education about opioids on promoting safe and effective pain management, expanding treatment for opioid use disorder, improving education and treatment of opioid use disorder for healthcare providers, removing barriers to coverage of approved medications for treatment of opioid use disorder, leveraging prescribers and pharmacists to help address opioid use disorder, and improving access to naloxone and safe injection equipment. In a 2022 study published in a Public Health Reports article, 446 nonprofit hospitals were analyzed from between 2015 to 2018 to see how they handled the issue of opioid use. And these are the results that they found. 118, so 26.5% of hospitals, offered substance use disorder treatment services. 126, or 28.2% of hospitals, offered support access to services in primary care settings. And 28, or 6.3% of hospitals, offered harm reduction programs. Harm reduction programs refer to evidence-based and client-centered efforts to reduce the harm someone might sustain while using drugs. In these programs, it's acknowledged that someone is using, and it actually provides them a safe, clean space to do so. Many also offer test strips to ensure their drugs aren't laced. Now, the goal of this might seem counterproductive, but evidence has actually shown that harm reduction programs have been proven to prevent death, injury, disease, overdose, and substance misuse. Essentially, the idea is that having an environment for safe use and being in a setting around compassionate, informed people who might help the user to eventually take the steps to stop using is more beneficial than being in an unsafe setting where they are more at risk for negative consequences associated with drug use or are treated in ways that would only contribute to them continuing using. Not only this, but studies have shown that these programs are useful in increasing people's exposure to treatment options. Furthermore, referring to the 2022 study, 141, or 32.6% of hospitals offered risk education programs, 65, or 14.6% of hospitals treated opioid overdoses in their emergency departments, 31, or 7% of hospitals addressed the social determinants of health, mainly having programs aimed at addressing health disparities and the health or safety of underserved populations in the communities. 28, or 6.3% of hospitals took on prescriber initiatives, which are initiatives that seek to ensure prescribers are being mindful about the medications they prescribe to patients. 19, or 4.3%, engaged in advocating for users at a local, state, or federal level, and 113, or 25.3%, were involved in local coalitions to address the opioid crisis in their communities. This study showed that although there is a good understanding for what can be done to aid those impacted by opioid use, more could be done both clinically and non-clinically to aid them. With even researchers from the Lancet concluding, quote, "Although commendable, most government efforts have focused mainly on secondary and tertiary prevention to avert relapses, overdoses, and deaths. Unfortunately, public health authorities and policymakers are still reluctant to prioritize primary prevention to tackle drug use and the opioid crisis. If we do not put enough focus on primary prevention to discourage people from using opioids as recreational drugs and from abusing medicated opioids, we will not be able to defeat the growing opioid crisis in our region and worldwide. More primary prevention campaigns must be implemented alongside currently favored health policies." All in all, as we tie everything together, while it is to some degree reasonable to have fear regarding potentially contaminated candy, especially after seeing such warnings and seeing busts that have happened with Rainbow Fentanyl and candy packages, based on the evidential lack of correlation being seen between the two, This, fortunately, is something you most likely don't have to stress about during the Halloween season. Needless to say, even though there has been no reports of rainbow fentanyl being found distributed in children's Halloween bags, it still is a good idea to always check the candy your child comes home with, almost the same way it's important to check on food items or medications with safety seals to make sure those are intact and haven't been cut or opened. The FDA has shared Halloween food safety tips for parents on their website. In the list, they cited advice regarding snacking, safe treats, food allergens, and smoking hazards, specifically mentioning making sure your child doesn't snack from their Halloween bag while they're out trick-or-treating, and only letting them eat their treats after you've inspected them at home. Ensuring your child doesn't accept and especially doesn't eat snacks that haven't been commercially wrapped, and making sure that you check for signs of tampered treats, such as an unusual appearance or discoloration, tiny pinholes, or tears in wrappers, and ensuring that you throw away anything that looks suspicious. Making sure if your child has allergies that you check labels to make sure the allergens aren't inside the treats, and ensuring that you don't allow your child to eat any home-baked goods they received while trick-or-treating. And lastly, checking for very young children if there's anything like gum, peanuts, hard candies, or small toys in their treats to avoid choking. Likewise, there are things hospitals themselves have even cited as main things being a concern they find during Halloween night. For one, pedestrian safety. There are several things that contribute to the concerns of pedestrian safety during Halloween, most notably being a steep uptick of pedestrians, people walking in low visibility areas that are not typically walked in, more parties and intoxication, and people walking in costumes that might impede their vision or mobility. SCP Health actually stated that children are twice as likely to be hit by a car than anyone else on Halloween, and it's further stated that costumes apparently play a notable role in this. But not only this, but hospitals have also cited concerns of physical injuries related to Halloween. There have been many injuries that hospitals have cited as things they expect to see in their emergency rooms each Halloween. This includes things like wounds, hand wounds, pedestrian accidents, and fire-related injuries. According to SCP Health, between 2007 to 2016, there have been over 700,000 cases of children and teens who've reported injuries relating to Halloween, and 1 in 5 of these injuries were ones to the head. Not only this, but there's also something called Halloween hand, and this is actually how many hospitals refer to the lacerations that people get every year while carving pumpkins, which is said to apparently be a very common problem. Next, fire-related injuries may not be the first thing you think of when it comes to Halloween injuries, but they're also quite common. Between jack-o'-lanterns with real candles and some decorations with smoke and light displays, fires are a common occurrence on Halloween. According to the National Fire Protection Association, around 860 decoration fires were reported on average between 2009 and 2013, and these fires caused an average of 1 death and 41 injuries per year in that time period. Eye and tooth injuries are also common due to things like sharp costumes and props, hard candies, and even falls. And lastly, regarding injuries, dog bites are also reported as being a common injury during Halloween due to the fact that dogs might not be as used to people coming onto their property and would often bite trick-or-treaters when trying to protect their homes. Circling back to the concerns related to intoxication, an article posted by Board Vitals in 2017 stated that the National Highway Traffic Safety Administration said that 43% of all car-related deaths that occurred on Halloween between 2009 to 2013 were due to intoxication while driving. Not only this, but it's also been cited that due to parties that often get out of control with drinking, there's typically an uptick in disorderly conduct or violence-related injuries and crime on Halloween night. This is just an example, but one case mentioned in that Board Vitals article included an incident in 2016 where apparently 2 men were arguing and fighting in Times Square when another man dressed in a Cookie Monster costume tried to break up the fight only to get stabbed in the spleen. And lastly, but not least, as mentioned, another health concern for hospitals on Halloween are food allergies. Considering worldwide around 4 to 6% of children have some sort of food-related allergy, naturally it's a concern for children consuming food from strangers, especially if ingredients aren't checked beforehand. The PSA about Halloween safety from 1985 even brought up these very concerns.
Making your costume and your bag easy to see makes you easy to see. And that's a good way to help make Halloween safe. The safer Halloween is, the more fun it is, for you and for me. That's what I think.
And even the PSA from 1977 brought them up as well.
One of the problems with this costume is that it's too long. It's too easy to trip over a long, full skirt. So we can shorten the skirt. We should always shorten any skirt, pants, slacks, or cape that is too long or floppy.
The opioid crisis is a problem affecting communities in the States and even worldwide. So it is reasonable to be concerned, especially for young people coming across something like Rainbow Fentanyl in a candy package, or even, let's say, accidentally ingesting it. These are all reasonable concerns, but it again just emphasizes the importance of educating people and raising awareness on how to recognize these drugs, how to avoid them, and what to do in a situation where they or somebody they're around is exposed to them. And it emphasizes the importance of having support and resources available to those struggling with opioid use. So while you may not have to necessarily worry that Rainbow Fentanyl will be in your children's Halloween bags, it's still important to check their bags. And it's very important to make sure that especially older children are educated on the dangers of such drugs and that they have resources available to help them if they're struggling with opioid use. And it's also very important to keep a safe and healthy space where children can come to you to discuss any of the struggles they're facing. Overall, as a society, if we can make the effort to make such changes, hopefully we can protect our communities and not have to stress as much during the spooky season. But yes, that is it for this case. What are your thoughts on everything we just discussed? Please comment your thoughts below, and don't forget to subscribe so you don't miss any other videos on medical cases, crime, and mysteries. Bye now.